Hi, everyone. Two terms that frequently appear in discussions about medical evidence in the VA disability system is causation and aggravation. While they sound similar, they describe two different medical relationships between conditions. Understanding the difference will help explain how clinicians evaluate whether one condition may be related to another. So what is causation? Causation means that one factor directly contributes to the development of a condition. It is a very clear and definitive situation. It doesn't always happen in medicine very frequently. So identifying causation involves examining whether a particular exposure, injury, or biological process can reasonably lead to the development of a disease. But since diseases are complex, it can be hard to really determine that as a one-to-one relationship. Repeated exposure to extremely loud noise can damage structures within the inner ear, potentially leading to hearing loss. That's one really solid example. The relationship is supported by well-established research in auditory trauma over decades. When evaluating causation, clinicians will consider the timing of symptoms, onset, known biological mechanisms, documented exposures of injuries, and look at the medical research supporting that relationship. Let's understand aggravation a little bit better. Aggravation refers to something entirely different. Instead of causing a condition to develop, aggravation involves the worsening of an existing condition beyond what would be normally expected to happen over time. That's a little bit more specific for the VA. Many medical conditions have natural progression, meaning it will naturally worsen. Some of those examples are degenerative joint disease, may gradually worsen with age. Migraine disorders may fluctuate in severity over time. And so when evaluating aggravation, a clinician often looks for evidence that something accelerated or intensified the condition beyond that typical course of what most people experience for that condition. You also want to consider evaluating the baseline severity. This is important. It's a very important concept in evaluating aggravation. Baseline refers to the level of symptoms or impairment that was present before the aggravating factor occurred. So medical records may help establish this baseline by documenting such things as prior symptom severity, treatment pattern, diagnostic findings that might have changed, functional limitations that were present before or that were not present before. Comparing earlier records with later findings will help clinicians evaluate whether the condition has changed significantly. There's another factor that you need to consider, which are biological mechanisms. When evaluating both causation and aggravation, medical clinicians will often consider biological mechanisms. There are several examples. One would be chronic stress. So chronic stress responses can influence cardiovascular function. Sleep disruption may affect hormonal regulation and inflammation. Neurological injuries may impact many body systems, and so they have a wide variety of impacts. So these kind of mechanisms can help explain how different conditions may influence each other medically. So taking a look at this, it's very complex, and causation and aggravation are both important concepts in understanding how different conditions can be related, but you have to be very careful in evaluating this. You need to look at a lot of factors: medical history, the evidence, known biological mechanisms, how other conditions impact each other, and what that particular veteran's evidence looks like is very different than another.